Hi, Lauren.
Hi, Tudor.
So, yet another eventful day here at ISC. A lot of exciting abstracts in the plenary session, and I wanted to ask you what caught your eye.
Well, and I think the Stroke Ready was so inspiring, right? We had just heard George Howard talking about racial disparities in stroke and the incredible burden of stroke, particularly among Black Americans. And then to see Dr. Scaleras and Elder Bailey presenting a real community engagement program that, while it didn't statistically significantly find a difference in the TPA rates, they had eliminated the racial disparity in TPA.
Yeah, that was
really
quite remarkable. And even though formally the study was not positive, there were a lot of positives that have been accomplished in that study. Just the fact that Flint is one of the communities with the highest TPA utilization is quite remarkable, and they started off from not a great position.
Yeah, inspiring. It's great to see an implementation study succeed in its implementation, right? And hopefully it'll be sustained, because now they have all these trained community educators that are out there and continuing to work.
Yes, and I think this is something that should be replicated at multiple other levels, and it's an example of how community interventions can actually make people better.
Yeah, inspiring for sure. And what about Trace 2?
Trace 2 is another great contribution to the growing literature that TPA and TNK are at least equivalent. Mm-hmm. It's nice to see that this applies to the Chinese population as well. And I think it will only accelerate even more the trend that we're seeing everywhere of TPA being replaced by TNK.
Yeah, and it's certainly a lot faster to give. And so systems-wide, it's a lot easier to give, and hopefully this will be implemented more and more now that we have the reassurance of more trials and more data.
Yeah, absolutely. The ease of administration tops everything, and it's really, I can tell you, we have implemented this 3 years ago, mm-hmm. Almost across our system, and everybody's happy with that. There's no unhappy players following this change.
Yeah.
It at multiple levels is a better option.
And it eases the burden on nursing as well, which is a
significantly.
Huge piece.
Yeah.
And then the last study that we got to hear about today was LACI 2.
Yes,
so
two LACI 2 trials.
Yeah.
Yes. Very intriguing data. It's phase 2, so should be confirmed in a phase 3 trial that is already sounds like well advanced in the planning stage.
Yep.
And what really what I found remarkable is that because of this composite score, mm-hmm. presumably they were able to increase the power significantly. The need was, we were used to antiplatelet trials that require thousands of patients. Yeah. And here you get some statistically significant results, although they're exploratory, with just a few hundred. So that's remarkable.
Yeah, indeed. And it was nice to see, in that primary composite outcome, both the cilostazol and the isosorbide mononitrate had strong trends towards benefit. And then when you have the combination in this 2x2 factorial design, then you really saw a really significant benefit, statistically significant, but really confirmatory of this interaction. So I look forward to LACI 3.
Agree. It looks like, it's obvious that the investigators have put a lot of thought into the design of it, and it's refreshing to see that, as we mentioned yesterday, to see that we're getting positive signals finally, not only in thrombectomy, but in a lot of other types of stroke, and especially small vessel stroke has been something that we didn't have good answers for a long time.
And I like the approach of treating this as an endothelial disease,
Yeah.
right? And also looking at not just stroke recurrence, but cognitive vascular dementia. So that brings us to the cognitive outcome that they also presented in the plenary.
Very intriguing, very important. I think we're in general underestimating the burden that cognitive impairment has as part of stroke, and the burden on in general on the society for vascular cognitive impairment. We had no answers to this problem, and this is a very promising approach, and definitely deserves a confirmation in LACI 3. I'm looking forward to seeing those results.
Yeah.
Hopefully soon, and hopefully here at ISC at some point in the future.
Indeed, and just to highlight that that it was the isosauride mononitrate that really drove that cognitive, that slowed the rate of cognitive decline, which is fascinating. So we'll see again. Hopefully, we'll put a ping in for ISC 2026, 2028, whenever
Yes, exactly.
LACI 3 is done. Great chatting with you.
Great talking to you, Lauren, and looking forward to another chat tomorrow.
Yeah, indeed.